Good day. Welcome to another edition of the Ministry of Health's virtual media conference on the COVID 19 response. Today we have with us Dr. Roshan Parashram, Chief Medical Officer, and Dr. Miriam Abdul Richards, Principal Medical Officer of Institutions at the Ministry of Health. I'm Candice Alcantara, Manager Corporate Communication at the Ministry, and I will moderate this morning's media conference. We go straight to Dr. Parashram for today's clinical update.
Hi, good morning, Ms. Alcantara. Good morning to Dr. Richards, members of the media, members of the viewing and listening public. So if I could have the first page of the COVID-19 update. So we begin with the COVID-19 update for the 21st of December 2021. Total persons tested so far at the public and private facilities, 488,278. Number of new positives over the last 24 hours, 723. Total persons positive since 12th of March 2020, 86,596. Total recovered patients, 68,179. Those with active COVID cases are now stand at 15,778. Of those in home isolation, 14,338. Total deaths thus far, 26,039. And condolences to the families of all of those who would have lost loved ones over this time. Number of patients in hospital, 523, and in step down, 194. And Dr. Richards will go into further detail with this particular cohort of patients. Total patients in state quarantine facility, 34. And just to give you a little summary of the vaccination, so far on the bottom right-hand side, you see the total persons with a completed vaccination schedule, which includes the single dose regime, 47,287, now stands at 661,746 as of 4 p.m. yesterday. In terms of our booster program, total persons with an additional primary dose and booster, 60,208. If I could have the next page, please. So the next page breaks down the hospital patients a little further. 523, as I said, in terms of the hospital. 103 of those at the Couva Hospital and Multi-Training Facility. At the Cora Hospital, we have 81. Augustus Long, 51. St. Anne's, 24. New Point Fortin Hospital, 92. St. James Medical Complex, 55. Scarborough Regional Hospital, Fort King George, 44. And Scarborough General Hospital at Signal Hill. We have 6 persons at this time. If I can have this slide just to do some on the boost your protection slide, yeah. So it's just a change on this particular slide. So it gives the 4 vaccines that would have been given out on the left-hand side, vaccine type. So we have AstraZeneca, Sinopharm, Johnson & Johnson, and Pfizer. That's on the first bit on the top. Date of final vaccine dose received. So for AstraZeneca, Sinopharm, and Pfizer, we're looking at 6 months post your second dose. For Johnson & Johnson, we're looking at 2 months, at least 2 months post your second dose. And the dates on the right-hand side, the date booster vaccine is due, will then apply. This slide was showed before. But in terms of what has changed, because of the new guidelines related to WHO's interchangeability of vaccines, you notice on the far right corner, under the orange label which says booster vaccine, any COVID-19 vaccine which has received WHO EUL, emergency use listing approval, can now be used interchangeably with any of your primary dosing series. So for example, with AstraZeneca, you can now boost with Pfizer, you can now boost with Sinopharm, or you can boost with Johnson & Johnson. Of course, AstraZeneca is no longer in the system, at least at this point in time. So again, just to reiterate the locations, because we have been getting some calls as to where you can have these boosters. So we're beginning with the Northwest Regional Health Authority. You could have it at 2 locations in the Northwest. That's the Queen Park, Savannah Paddock, and the Hazley Crawford Stadium. At the ERHA, you could have it at the Sandy Grande Civic Center, Hanjarad Sumer Singh Multipurpose Complex, Mayaro Sporting Facility in the North Central Regional at the Costart El Dorado site, Larry Gomes Stadium, Wallerfield International Racecourse UTT Chagones Campus, at the Southwest Facility SAPA, Southwest Regional Indoor Sporting Arena, Point Fortin, and the Davie Health Center, and the TRJ at the Scarborough Health Center, Canaan Health Center, Roxborough Health Center, Moriah Health Center, and Portmore. So, Ms. Alcantara, that brings me to the end of my clinical update for this morning.
Thank you very much, Dr. Parasram. And we go now to Dr. Abdul Richards, who will give us an update on the parallel healthcare system.
Good morning. Thank you very much, Candice. Good morning to CMO Dr. Parasram, to members of the viewing and listening population, and to all members of the media that have continued to join us at our Ministry of Health press conferences. This morning, I will be providing a status update on the situation at the hospitals in our parallel healthcare system. This information is as of 8 a.m. on Wednesday, the 22nd of December, 2021. So I'll start with a few slides that we would have prepared to summarize the changes. Okay, so we'll start discussing the information that was put forward. The rolling average as of yesterday evening continues to be high. It is currently at 677. And this information regarding the increase in rolling average really has been congruent with respect to the number of persons that have been hospitalized. So an increasing number of cases results in an increasing 7-day rolling average that then results in an increasing number of hospitalizations and, of course, the perceived burden on the parallel healthcare system. Now, we have noticed as well over the last 2 to 3 weeks that the number of net admissions in the parallel healthcare system continue to increase. We look at net admissions because it indicates the additional strain on hospitals in the parallel healthcare system. And a net admission is the result of the total new admissions subtracted from the total number of discharges. Since October 19th, we have noticed an increasing rolling average as well as an increasing number of hospitalizations. We also have the Delta variant that is now established in our community. And so we have noticed that persons being admitted into hospital are entering into a more clinically severe medical condition, and so they spend longer in hospitals. So we are seeing the net effect of this, which would be an increased number of persons in the hospitals in the parallel healthcare system, as well as the accident and emergencies, coupled with a decreased number of persons being discharged. The net effect is an increasing strain on the parallel healthcare system and our accident and emergencies as well. Just for context, the net number of admissions over the last 5 days in the parallel healthcare system has been 112 versus 153 for the 7 days previously. Given the average number of persons that are admitted into the parallel healthcare system per day, we believe that this trend would note an increase and a consistent increase beyond the 153 by the end of this reporting week. I would like to now share some information on the actual number of patients in the parallel healthcare system. The parallel healthcare system at this point in time consists of 16 facilities across Trinidad and Tobago. And last week, Tuesday, we operationalized an additional facility at Lowlands with a bed capacity of 26. So that became our 16th facility. As of this morning, there are 543 persons in the hospitals in the parallel healthcare system, 206 in step-down facilities, and so the total number of persons in the system is 749. This is the highest number of patients in the parallel healthcare system since October 19th, 2021, when we started noticing that upward trend. And I must say that the trends that I will be discussing and I am discussing are consistent for the past 65 days. I'd like to now share some information with respect to the accident and emergency departments before we discuss a breakdown of the ICU and HDU levels of care. As part of Delta preparedness and based on the trends that the Ministry of Health and the RHs were noted, we did increase capacity at the traditional accident and emergencies to cope with the increasing demand for care. Our accident and emergencies continue to be inundated with a large number of critically and severely ill patients on a daily basis. As of 7 a.m. this morning, there were 169 persons across 4 accident and emergency departments in Trinidad receiving medical care. Of those, there are approximately 32 ICU level patients receiving medical care. Many of the ICU level patients are arriving at the accident and emergency department too late, and so their clinical status is deemed unstable. In this regard, we continue to manage the ICU level patients as per the Ministry of Health protocols on site at the accident and emergency department. And if clinically stable, we transfer them to a hospital in the parallel healthcare system. It is important to note that 100% of the ICU level patients in the parallel healthcare system, in the traditional accident and emergencies in the parallel healthcare system are not fully vaccinated. And we have noticed since October 19th that 90% to 100% of ICU level patients in the A&E are not fully vaccinated. And this underscores the relevance of vaccination as a preventive mechanism for being hospitalized with COVID-19. If we looked generally at the accident and emergency status, 87% of all persons in the accident and emergencies this morning are not fully vaccinated. We would have been discussing in the past media conferences the percentage of patients in the intensive care units. And of course, as part of Delta preparedness, the Honorable Minister did request that the hospitals increase and double the ICU capacity, which was done on a phased basis based on demands. Of course, I'd like to remind everyone that a bed is not a bed, and human resources continues to be the limiting factor for operationalizing beds. The bed status is a dynamic situation that changes on a daily basis dependent on the clinical status of patients in the A&Es, the availability of supporting resources, human resources, equipment, and otherwise, and of course, the actual physical infrastructure that we have available. And this morning in Trinidad, there are 67 operational ICU beds and 9 operational beds in Tobago. This is within the parallel healthcare system and not considering the A&Es, where there are an additional 31 beds. In Trinidad, 58 out of the 67 beds are filled. In Tobago, 6 out of 9. And of the 58 persons in Trinidad who are in ICU, 50 are not fully vaccinated. So we have noticed here that 87% of all persons in ICU in Trinidad and Tobago are not fully vaccinated. Across Trinidad and Tobago, the percentage occupancy is 87% if we consider the number of beds that are filled between Trinidad and Tobago. And this is a consistent trend. We've seen the ICU fluctuate anywhere between 78 and 94% over the last 65 days. The status with respect to our supporting infrastructure, such as the ambulance system, continues to show an upward trend, and we continue to do all in our part to improve the operational efficiency of our processes. However, as of today and this morning, we are managing over 900 COVID positive patients who are all critically and severely ill in our traditional accident and emergency departments, as well as the hospitals in the parallel healthcare system. Our overall occupancy is now 83%, and this is in spite of us increasing beds on a phased basis and trying our utmost best. As I end today, I would like to appeal on behalf of every frontline worker and all those associated with the parallel healthcare system and the health sector to please be vaccinated. Vaccination is a proven and effective way, alongside the 3Ws, to decrease your risk of being hospitalized in the system. I wish everyone very safe and Merry Christmas on behalf of the frontline workers and our hospital staff. And the CMO will do greetings as well on this end. Please be safe. Thank you.
Thank you very much, Dr. Richards. And we go back to the CMO who has some additional information on vaccination.
Sure. So I just got the latest update, which would be from last night around 8 p.m. in terms of the vaccine figures. So to give some idea of what is happening, we would have had now completed vaccination 662,870, representing 47.3% of the total population of 1.4 million people. The daily boosters given out yesterday was 2,818, and the first doses were 1,096. So first doses by type, we had Pfizer 404, Sinopharm 409, and Johnson & Johnson 283. Just by way of the boosters, and just to remind everyone, although we are looking at all the combinations, just to seek the counsel of your healthcare worker before you actually going to the site to determine which combination is best for you in terms of safety and efficacy. And also look at the travel requirements. For example, if you're looking to travel to other countries, which combinations they are accepting as well before you go ahead and have your final vaccine. For pregnancy, as it relates in Trinidad for now, we accept or we're offering the Pfizer vaccine, and we'll be boosting with Pfizer as well. And then finally, when you go for your booster, make sure you walk with the necessary information, which is on our website, your previous vaccine cards, if you have it, as well as your identification. Thank you, Ms. Alcantara.
Thank you very much, Dr. Parasraman. Just before we go into the question and answer segment, we just wanted to advise the population that in response to feedback that we have received about the daily updates, just know that the ministry will soon be adjusting the layout of this update to make it easier to read, but note all the additional information will still be available on the website. So that's coming soon, and we will advise you when we switch over to the new layout. And we go now into the question and answer segment. In the usual fashion, I ask our media representatives, please begin by stating your name and the name of the media house that you represent before you put forward your two questions at the same time, please. In order for us to get the most out of this segment, we must acknowledge the time constraints, so no more than two questions and brief questions, please. And if we have additional time, we will come back to you if you have another question. We start this morning with a question from AZP News, please.
Good morning, Priya Bihari, ACPnews.com. Season's greetings to all. My first question is to CMO and the second is to Dr. Richards. CMO, are we seeing fewer cases or decrease in cases of ailments such as the common cold, the common flu, etc.? Because one doctor has told me that he hasn't seen a case of dengue yet for the season. So I don't know if there's something that has caused this. If you give any reason for this. And my second question to Dr. Abdul Richards, I wanted to find out if the Eric Williams Medical Sciences Complex is part of the parallel healthcare system, because we are getting reports that people are dying there of COVID, and they're also keeping COVID-19 patients there. Can you explain that? Thank you very much.
So prior your first question, generally what we have been seeing is a trend. I think we presented many times last year that we have a decrease in the general incidence of viral illness as well as gastroenteritis across the population. And a lot of things, mainly the public health guidelines that were instituted together with the 3Ws, go a long way in preventing other infectious diseases as well. When we look at the figures, for example, for dengue, as of the 11th of December, we have 19 suspected cases so far for the year. as compared to 84 for the same period last year. But if you go back a few years ago, before these instances would have happened for dengue, for example, we would have had about 3,000, 4,000, or as high as 5,000 cases of dengue in the preceding years. Similarly, with influenza, we have 179 suspected cases of influenza as of December 11, 2021, compared to last year, 853, which is significantly low as well. But if you go back into 19 and 18, you'll find that those numbers go into the thousands again. So the public health measures have gone a long way to actually decrease the incidence of other infectious diseases, because those diseases as well respond well to wearing of masks, they respond well to washing your hands. So there's a general decrease in the prevalence of those diseases throughout the country, and it has been noted as early as middle of 2020 in terms of our data.
Thank you, Prior, for your question, which really has summarized and brought home the point of the severeness of severity of this current wave that we are experiencing of COVID-19, and given the presence of Delta and the Delta variant in our community. As part of the Delta preparedness plan that we would have started in July of this year, prior to the arrival of the Delta variant, we did look at increasing the capacity to care for COVID-19 patients in the traditional accident and emergency departments, as well as the parallel healthcare system. We noticed the consistent trend in persons arriving severely and critically ill via the ambulance service to the accident and emergency departments in the parallel healthcare system, which would have been their first point of contact. And with this in mind, each accident and emergency department, especially at the main hospitals, San Fernando, San Grande, Port of Spain, and of course at the Eric Williams Medical Sciences Complex, did expand their available biocontainment or isolation areas and enroll a dedicated ICU level and multidisciplinary team to manage these patients. I'm aware of your concern, and we are as well, of persons who unfortunately pass away in the biocontainment or isolation unit. But we need to remember that persons are arriving too ill and they are not fully vaccinated. So, unfortunately, they are not giving themselves the best chance. So, we would like to once again stress the importance of vaccination in our population to reduce the risk of persons dying and succumbing to COVID-19 at our centers. Thank you.
Thank you, Dr. Richards. Let's go now to Guardian Media Group, please.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. Okay, so my first question is for the Chief Medical Officer. Dr. Parasram, could you just explain the difference between that third primary dose and a booster dose? And some people have been asking, if they've gotten that third primary dose, do they now need to take a booster shot after some time has passed as well to make it a total of 4 shots they've taken? And Dr. Richards, I know you would have spoken there a bit about that situation of people coming in late to the accidents and emergencies and that sort of thing and then dying. But do you have any numbers or figures of how prevalent an issue that is?
Yeah, thanks, Rashad. So in terms of the primary additional dose, as we explained before, the primary additional dose is meant to get your primary series up to a point where the immunity that you have is considered adequate, right? It's usually done to augment the primary additional series. For certain instances, for example, in the immunocompromised population, those who are moderately severely so, the difference between that and the booster program, again, is really an augmentation of your primary series to bring you up to what the level of someone else who is not immunocompromised would have had. So, for example, we used the example before of someone over 60 for Sinopharm. We're expecting those persons across the board to have 3 shots. In terms of requiring a 4th shot thereafter, I think the data is still out, but at least from a theoretical perspective, if you have a primary additional dose, making your series complete, it will therefore mean that you will need an additional shot as a booster. In terms of timeline, it will probably align to what is going on now, meaning 6 months for most vaccines, 2 months for 2 to 6 months for the Johnson & Johnson vaccine. So I hope that clears up the question.
Thank you very much for that response. I think we go to Dr. Richards for response to the second question.
Thank you, Rashad. Your question is noted regarding the place of death of persons and their clinical status. The Ministry of Health continues to compile this information based on the information and data that is received from the Accidents and Emergency Department, and it will be presented at a later date when all the information has been verified and reviewed. Thank you.
Thank you very much. Let's go now to Express Newspaper. Express Newspaper, we're ready for your questions at this time, please.
Good morning, Kim Woodram from the Express. Best Christmas wishes to everyone. Perhaps the CMO would take my questions. Can you tell us the expiration status of our Sinopharm stock, and it may be in the context of if people were to start seeking Sinopharm with the idea that they would want to get Pfizer as their booster shot, are we in place for that to happen in the coming months? Also, do we have the status of our Pfizer stock as a booster shot for those people who are able to take it? Perhaps how many we have, and if we anticipate that we'll be okay for everyone who has had the previous 2 shots and can now take Pfizer to just start coming in and have their Pfizer booster shot. Thank you.
Okay. So I think you're asking about the breakdown of the Sinopharm. So just to give you a little breakdown. Sorry. A little breakdown. You're asking about the expiry of the Sinopharm, which is usually on when we got there's different batches that we got, but to the most part, they're all expiring in 2023. So we do have some time in terms of the expiry on those. The last stock, if I recall, that we had on hand in Sinopharm was 350,693. That was a few days ago as of December 16th. By way of Pfizer, we have in stock 370,585. And Johnson & Johnson, we have 212,203. All of the same date. In terms of the Pfizer, as you know, we have catered for enough boosters for Pfizer, people who want to follow on with the Pfizer series, the homologous series. And we also have enough Pfizer in place if you want to do that interchangeability across the board.
Thank you very much. Let's go to Express Newspaper, please. Sorry, we just passed Express. Let's go to TV6. My apologies. TV6, let's hear your questions, please.
Hi, good morning. Alicia Boucher from TV6 here. My first question is for Dr. Richards. Dr. Richards, can we get a breakdown of the facility at Lowlands that you spoke about with the 26 beds? How many of those beds are ICU, HDU, ward level, and so on? And Dr. Parasram, you gave some advice to pregnant women in terms of the booster shot that they would be taking. Of course, that would be Pfizer, but I wondered if you have any guidelines for breastfeeding women in terms of the mixing of vaccines in particular. Thank you.
Yeah, thank you. So yes, as you know, the Sinopharm, both the Sinopharm vaccines and the Pfizer vaccines have been approved for breastfeeding mothers. The Pfizer alone for pregnancy. So there can be some mixing after delivery of the baby into that status. So you can use both Sinopharm and Pfizer.
Thank you. And to Dr. Richards.
Thank you very much, Ms. Boucher, for your question. The Lowlands facility was developed by the TRHA and THA in response to the increasing number of cases. It is a step-down facility for medium acuity patients. So the facility can accommodate approximately 27 persons, and as of 8 a.m. this morning, the TRH's report submitted to the Ministry of Health indicated that there were 14 persons at this facility. So it is not a HDU ICU level facility as in the hospital. It's a medium acuity step down facility with the availability of oxygen via mobile tanks if required. Thank you.
Thank you very much for responding to those questions. Let us go now to some additional questions. Let's go to AZP News for an additional question, please.
Good morning again, Private Harry, ACP News. I just want to follow up Dr. Richards. Dr. Richards, when people who would have gone to the E&E departments and they have COVID and they passed away, is that recorded as a COVID death? And how many such deaths we have had due to COVID that has not been in the parallel healthcare system? Thank you.
So Prior, let us hear that first part of the question. I think we missed something in the first bit. So just repeat the first part of it. So
sure. When someone has COVID and is in the A&E department and passes away outside of the parallel healthcare system, is that recorded still as a COVID-19
yeah,
death?
sure. Yeah. So all persons who are COVID positive at the time of death in Trinidad and Tobago are recorded as a COVID death in our statistics. As we described before, there are persons who would have died of causes that may have been there before. So we recording the deaths, both people dying directly of the complications or as an antecedent cause. So all persons that would have been positive at the time of death would have been recorded as COVID positive, regardless of their site.
Thank you, CMO. Let's go to Newsday for 2 questions now, please. Newsday, we're ready for you.
Okay, morning, Clint Chantak of Newsday. Season's greetings to members of the panel and all healthcare workers. My first question is, based on what was on the data being presented about the severity of all these people coming in with the conditions that they're in, and what is the current policy in terms of testing and surveillance for these people coming in as they reach in to these centers, and how does that currently exist within the public health sector? And secondly, is there any information regarding a group of passengers who would have come in, who were part of a CAL flight that got stranded accidentally in Puerto Rico and came in subsequently? Any evidence of any of these people contracting COVID? And I believe there was a death on the flight as well. Was that a COVID-related matter as well?
All right, let me deal with the flight first. So that flight that was stranded in Puerto Rico was as a result of a death that occurred on the flight, not as far as I'm aware, not related to COVID. Persons had to stay an extra day, I believe, in that jurisdiction before they came to Trinidad and Tobago. What we found when they actually arrived here, there were 16 people who had gone beyond the 72-hour PCR policy in terms of entry for Trinidad and Tobago. We would have held those individuals at one of our step-down facilities for a short period while we did a resampling program. Out of the 16 persons, we got 1 positive individual. The positive person was taken to a step-down, and he actually was confirmed, because we fast-tracked the sequencing, as one of the Omicron cases out of the 5 that we have so far. A second individual from that flight as well would have exhibited symptoms, tested, and then again fast-tracked, and would have been 2 cases. So there would have been 2 cases who were positive, and both of them turned out to be the variant of concern on that particular flight. As it relates to our testing and surveillance policy, generally speaking, we have used the same sort of approach throughout the pandemic, where we would have tested cases who are symptomatic for any particular disease. So the testing regime is generally, if you have symptoms, you present to any of the facilities, you will be tested for COVID-19. As we have seen in terms of the recent times, we have a positivity rate in the persons with viral illness upwards of 50%. So generally speaking, we have been getting a high yield of positives from that particular sample. We also see beyond the public sector that people are now testing for other reasons, for traveling, for example, and you're picking up some asymptomatic spread in those groups. But generally speaking, it is aligned to persons with symptoms at this point in time, not only those who present to the primary care system, but also to the accidental emergency side of it. Those with severe symptoms are fast-tracked by something we call a gene expert test, so you get the turnaround very fast. I hope that answers the question.
Thank you very much, CMO. And let's go now into another additional question. Let's go to Guardian Media Limited for an additional question, please.
Good morning again. It's actually Kim Woodram from the Express. Thanks.
Okay, let me go ahead with Express.
Yes, thank you. Either doctor could probably take this. There are more than 14,000 people in home isolation, COVID positive, and we know this is a challenge for the ministry to monitor everyone. But we are still getting many, many calls from people saying that they were tested positive, whether public or private facilities, sent home, and they no longer have any type of contact with whoever they believe would be the relevant authorities. Nobody's monitoring them. They're not able to get onto hotlines, etc. Some of them have been at home a week and more. So, I mean, given the challenges, how is the ministry operating at this time in terms of monitoring people? Does it need to expand? What is on the table in terms of keeping these people in check? Thank you.
Yeah, so at the ministry, we are looking into, we understand that it is an issue. I think this is the largest number of cases we would have had in terms of active spread at any one time. The same 8 county medical officers of health have that duty to monitor these individuals on a daily basis, and 1 person in Tobago. So the numbers are really quite large in terms of what they have to monitor. So it would mean that they will really have to call 14,000 people every day. Most of these offices just have 5 or 4 persons that are responsible for this activity, and the capacity is the capacity is limited in terms of being able to do that activity. So through the Ministry of Health, we're trying to get additional staff in place to assist with that backlog. We are looking at prioritization in terms of the persons with comorbidities, the older individuals, to make sure that we do some active monitoring on those. But we're asking the population to assist us as much as they can. If your symptoms do worsen, that you call the 811 number, or you visit your accident and emergency as quickly as you can.
Thank you very much. And I think now we're going to TV6, is it? We're going to TV6 for an additional question, please.
Hi, good morning again. I'm not sure who would want to take this question, but I know that the ERHAs do facility transfers and stuff with their ambulances. I was wondering, in terms
Sorry,
of the
Ms.
large
Bushi, I think we
number
lost
of
you
cases that
for
we're
a
seeing
part.
now,
Okay.
how has that?
Sorry, let me just ask
Sorry?
you to repeat. We missed a little part of what you were saying. Can you repeat?
Okay, sure, no problem. I know that the ERHAs do inter-facility transfers and stuff for COVID-19 patients, but I was wondering, in terms of the high increasing numbers, the daily numbers requiring hospitalization, how has that been affecting response time with the ambulance in terms of GMRTT? And is the fleet adequate? Do we need to subcontract other ambulance firms and so on? So I was just wondering, can we get an update on that? Thank you.
So in terms of the subcontracting, generally speaking, the fleet, if I remember right from what Dr. Richards is saying, right now we're using about 50% of the fleet, correct? Yes. So we still have some redundancy in the system, and what we have noted as well as the other types of calls to the hospital have decreased significantly. So there's still some redundancy in the existing system, but I'll ask her to go into a little more detail as to the interfacility transport.
The accidents and emergency departments continue to provide or information to the hospitals and the parallel healthcare system, not just within their RHA, but in some
Developing a vaccine is a long road full of checkpoints. Different phases of testing are designed to make sure it is both effective and safe. But with the whole world struggling to contain a pandemic and unprecedented amounts of scientific work taking place, the road to finding the COVID-19 vaccine looks more like this. But first, let's take a look at the usual path. During preclinical trials, the vaccine is tested on animals to determine whether they develop antibodies to the disease-causing germ.